Doctors versus AI. Will AI replace doctors? Here's the truth. Hey everyone, welcome back to my channel, the Real Theo Harvey, and we're going to deep dive into a hot topic that's been making waves not just in the tech fields, but across the medical field. And that is AI, artificial intelligence, and what it means for the medical field. Will it replace doctors? Well, before you scroll away or hit comments about how AI can never replace doctors, doctors are irreplaceable, it doesn't even have empathy, doesn't have that bedside manner. Well, hold up. This isn't just a simple yes or no answer. This is a nuanced discussion that needs to be looked at from multiple angles, clinical, technological, ethical, and even economic. The whole conversation kicked off from a post on social media that caught my attention. A doctor said that they tried giving ChatGPT clinical scenarios, and the AI's responses were surprisingly good, even better than some of his human colleagues. Yeah, that raised some eyebrows, obviously. So today, let's break that down. Let's start with this. So the clinician said in this post, and obviously everything was anonymized, but it was so important because, and I'm paraphrasing this, he said the AI like ChatGPT offer more comprehensive answers to medical questions that some professionals they work with. So this is impressive, right? This is something that is a little scary if you're in healthcare, right? There you go. You have this new tool that just came out. And this is just what they call a large language model or LLM. These tools are doing complex analysis around things like ECG to understand what's happening and give expert level analysis previously that didn't exist. So for example, according to PubMed Central, artificial intelligence has significantly enhanced electrocardiogram analysis, right? Leading to more accurate and efficient detection of various cardiac outcomes and conditions. Here are some notable examples. There was a study that talked about heart failure detection. AI models demonstrated a poor sensitivity of 93% and specificity of 95% in detecting heart failures using ECG data. These figures surpass traditional ECG interpretation methods, which often have lower diagnostic accuracy for heart failure. There was a study that recently talked about an online Canadian Journal of Cardiology, where they looked at why complex tricardia or WCT classification, and the AI performance achieved an accuracy of 91.9%, sensitivity of 93%, and a specificity of 91.8% in classifying WCT, which is a huge condition. If you look at the non-electrical physiologists, cardiologists, they had a lower accuracy of 73% and sensitivity of 59%. And electrophysicists, physiologists, had comparable accuracy of 92.5% and sensitivity of 91.7%. So this is huge, right? You're saying that these AI systems are on par with the expert, especially when it comes to electrophysiologists in WCT analysis. And this is tons of studies are coming out more and more about how this is possible for a lot of AI driven details in that data analysis, right? One of the things that, we're seeing also, this is a huge article I saw in the Harvard Business Review. They did analysis of how people are using generative AI or Gen AI as they define it, which is a general term to use things like talk about ChatGPT, Claude, Anthropic's Claude, proximity, all these kind of models that just proliferate more and more. So they went into detail like how are people using it in 2025? This is a comparison to how people are using it in 2024. So looking at social media data, actual surveys, thousands of individuals out there and giving actual case studies. Last year in 2024, we were using AI for things like brainstorming, understanding new ideas for businesses, doing some code help. So here in 2025, we're seeing some of those same case studies, using it for coding better, for brainstorming ideas, things like that. But you know what the number one use case for AI in 2025? This blew my mind. It was using it for therapy. So people are actually using artificial intelligence and communicating with LLM models to help them deal with mental anguish that we're all suffering with during some of the trying times that we're dealing with now. This is amazing to me. So as you can see, patients are already leveraging AI to answer some of the medical questions and getting results. So then comes the real worry. If AI tools become cheap, which they are, right, with new models coming out all the time, and the training them becoming cheaper and cheaper, are they coming faster? Absolutely. doing analysis quicker, more deeper analysis faster. Accuracy, still some issues, but if they do become cheaper, faster, and accurate, do they devalue the work of human doctors? Even if they don't replace a doctor, do they make it easier for nurses, medical assistants, or even patients themselves to bypass doctors to get the answers they need from a medical standpoint? Are doctors, quite frankly, being overly pessimistic? And so let's tackle that. Well, are doctors going to go extinct? I know that's a crazy question, but I believe no, not with the current state of artificial intelligence. Let's zoom out. To fully replace a doctor, you need what's called general AI, right? This is a system or generalized AI that can do any task you throw at it, even if it hasn't seen that type of task before. Right now, artificial intelligence AI is still in a narrow phase, right? It's great at doing one thing specifically. Large language models are getting better at certain things, but they can only do one thing at a time, right? For instance, Chat GPT can typically only chat. If you want to do video editing, you need to have Sora, right, to kind of create videos for you, right? They have different models do deep research where you can get a nice long report on any topic you want. But they're different type of models that you have to log into and set up. They're not like a human being that can task switch and do different things with different tool sets. AI has not gotten to that point yet, right? Even in these new models where they're talking about creating agents that can replace human beings, they need to be built where they're connected to sub tools, other AI tools to do their job properly. So they're creating agents that act like human beings, right? But they still need specific tools and specific guidance to do the agent job. And even then, it's a very narrow scope of a job, right? You can create an agent to write your social media posts, but that's pretty much all it can do and create those drafts for you automatically based on your knowledge set, how you've written before, and using tools like ChatGPT. Can you get it to that same agent to do newsletter or to do an email blast? Probably not. You have to do some more changes or create a separate agent just to do your newsletters. So I think this is where we're kind of getting to, right? More generalized understanding. So it's great, like I talked about. ChatGPT is great at answering questions and even mimicking diagnostic responses to a degree, but asked it to solve complex math in real world context. It's getting better at it, but not there. But more importantly, asked to analyze an X-ray, you can get there, but can it figure out the nuances of why that X-ray, is important to understand that and get more deeper knowledge of that. So being a doctor actually requires hundreds of different skills, from medical knowledge to decision making, to patient communication, to physical examinations, and let's not forget emotional intelligence. Becoming a doctor in the United States is a rigorous journey that encompasses extensive education, training, and development of diverse skill set. Here's an overview, right? First, undergraduate, 4 years of general education. Then you have medical school, another 4 years, broken down to more classroom, preclinical years where it's classroom-based learning to get the basics of anatomy and things like that, and actual practical hands-on rotations as interns in their clinical years to kind of understand the practicality of what they're going to be practicing. Residency training is really that postgraduate training, chosen specialty under supervision, and it varies, right? It can be from 3 to 7 years depending on the specialty. Family medicine, typically 3. You're looking at general surgery, 5, and neurosurgery, another 7 years. So a total of 7 years. So these can be extensive trainings that you have to go through. And then last but not least, fellowships, where you're looking at 1 to 3 additional years. That's like a subfields under for internal medicine, for instance, cardiology, that you have to go into more deeper knowledge. And so this is a lot of understanding and knowledge, not just understanding of the medical field, but understanding all the nuances that go into it, up to 10 to 14 years. And not only that, but you have to have these skills stack up with it beyond the academic knowledge. You need to have the technical proficiency, accurate diagnosis, treatment planning, staying updated with medical advancements, you're right, understanding how to put that in play, using critical thinking skills, right, to analyze complex situations. If you ever see TV shows like House back in the day, where he was basically a detective, right, to understand what was the underlying cause, troubleshooting the human body, not unlike someone would troubleshoot a computer to figure out what the underlying condition is. Yes, you have tests, but then there's the factor of understanding which test is best test for this situation. And tests give you different responses until you find the underlying condition. There was a joke in House when I used to watch this show that At the end of the day, someone always had lupus, right? You always throw that as a differential diagnosis, right? But in that case, they only had one or two cases in the history of the 5-year run or however long House ran that someone actually had lupus. And so because it just presented in so many different ways and gave test results that way. So finding out the underlying condition takes a lot of critical thinking and great communication skills to effectively convey information. But more importantly, ask the right questions to get the right answers back, because unfortunately, patients may not tell the truth or may not know everything. For instance, environmental factors can have a huge impact on a patient's condition. Emotional intelligence, right? Really have the empathy, compassion, but also having a firm hand and understanding how to communicate to a patient that you're an expert. I had a great show I used to recently watch called The Pit, where you saw a day in the life of an emergency medicine doctor and all the stress that comes with it. And they had a huge incident that a lot of people were injured, and they had to deal with the stress and managing that, right, without their emotions getting in the middle. No one wants to see their doctor cry. That was a line actually in the show. And I think that's true. You want a doctor that's empathetic, but not so much that they are incapacitated to help you with your concern. And then finally, professionalism, right? And that's just you're into ethical standards. And these are all so important. So that's not something you can just download, unfortunately, into a model at this point. Also, and this is very important, we can't just train artificial intelligence to replicate every single task a doctor does. Like I mentioned before, the volume, training day, and level of oversight, the cost of validation, it's just not viable financially. So doctors are safe, but that doesn't mean things won't change. So instead of thinking of AI replacing doctors, a better way to frame it would be AI will assist doctors, right? Coming together. Here's where AI already shines in healthcare. Radiology. Artificial intelligence is absolutely helping detect abnormalities in imaging faster than ever before. Algorithms are outperforming humans in detecting subtle ECG changes. For instance, I wear Apple Watch, has a way of detection atrial fibrillation, which a finger, you place your finger on the crown and it can actually do analysis of your heart, determine if you have an AFib currently, and that really helps. Ophthalmology, the ability to detect retinopathy detection from eye scans, right? This is so important. AI can absolutely do that in a few minutes. Ophthalmology, this can detect, understand if there's diabetic issues with your eyes, and AI can do that in a mere minutes. But there's other things here to think about, and this is a huge one. These systems are used in partnership with human experts, but not to replace them. Think of AI like a calculator. Calculators did not replace all the mathematicians, but they made math easier to do and to run through the process. AI can do the same thing for doctors, right? Free up time. Burnout is a huge issue with doctors since post-COVID. Reduce cognitive load so they can handle more because they're at a higher level and not bogged down in repetitive tasks that bog thinking process sometimes. You still need a human to synthesize the results and explain the outcomes and options and understand the nuance of the patient sitting in front of them so they have a clear communication path for them. And then finally, you want to kind of think about this part right here can hit a nerve for many doctors, right? If AI tools become too good, will it become easier for professionals who are not doctors to take over in the doctor role? Well, the concern is valid. So for instance, if a nurse practitioner is equipped with powerful AI assistant and it can manage 80% of a patient visit safely, what happens to the perceived value of physicians, right? And we're seeing doctor shortages, nurse shortages all the time. So as other folks rise up, actually expanding the scope of practice, what does it mean that the doctors can do and how to do that? But I have a counterpoint. Even if mid-levels get more capable, it doesn't mean less skills required. It just means the distribution of that skill changes. Complex cases, rare conditions, ethical decision-making, those still fall under the physician's capabilities and leadership. But guess what? AI could actually help doctors reclaim their time, right? Moving away from those repetitive tasks, those issues that bogged them down, clerical tasks, for instance, writing notes consistently inside the EMR. I talked on a previous video about using AI scribes to kind of document more effectively. And this opens up the brain for higher level clinical thinking and creating personal care for each patient population that they meet. So let's not forget the world we live in. Even if AI could do a doctor's job, would it be allowed? Legal regulations, malpractice concerns, institutional inertia. For instance, here in the US, you still can send patient information via fax machine, which has been around over 60, 70 years. This all acts as brakes on AI development. It's just not moving as fast as we would like it to be. No hospital wants to be in this headline. AI misdiagnoses a patient, lawsuit follows. In many regions, regulations require human oversight for decision making and medicine. Simply put, this is just not for safety, it's also for trust. Patients want to talk to people, right? Imagine the common question that comes up with physician to patient interaction is the patient will ask a doctor, if you were in my situation, what would you do? That connects the human to human because we all assume with that knowledge set, you would choose the best option for you. And so by giving us that knowledge, we trust that better, as opposed to a screen that we already know is calculated, right? It has no skin in the game, if you will, right? The computer doesn't care one way or the other. Even if it has more knowledge than a doctor, we just don't trust it as well, right? Especially when making life-altering decisions that can affect your life for the future. You just feel it more as a human being, ultimately. Global regulations emphasize the necessity of human involvement in any AI-assisted healthcare, right? Because you want to prevent errors and uphold ethical standards. For instance, California's SB 1120, this law mandates physician oversight for AI-driven utilization review decisions by health plans, aiming to prevent wrongful denials of necessary care. We saw this, right, with the unfortunate timely death of the United Healthcare CEO by a deranged person felt that they were being denied healthcare coverage. You don't want AI to be in the midst of that, right? And so this is something that has to, continue going forward. The European Union, or EU, classifies many medical applications as high risk, requiring human oversight, transparency, and explainability to ensure that healthcare professionals and patients can understandably and trust AI-driven determinations, right, at the end of the day. More and more, we're seeing studies consistently show that patients prefer human doctors over AI systems, particularly in emotionally charged situations. Research by Frontiers PMC indicates that patients are more likely to trust and adhere to medical advice when it comes from a human physician, even if the AI system is on par with the same recommendations. So it goes to show you that human touch is so much more important even now with all the technology and solutions that we have. And I think it's so key that we look at that for the future. So if you are a doctor, medical practice owner, physician, are you guys being overly pessimistic? No, not at all. You're being realistic. It's smart to ask these questions, and even smarter to determine the shift is already happening. I think we're seeing every time we turn on our television, look on our computers, getting bombarded with AI information. If you watch a Super Bowl, there are probably so many AI commercials that bog the mind, right? But here's the truth. Doctors who embrace AI will outperform those who ignore it. The future isn't AI versus doctors. It's AI with doctors versus doctors without AI. So if you're in healthcare, the best move you can make is to learn how to use these tools. And we talked about this on this channel. So go check out some of our previous videos where we go into deep dives on what ChatGPT is all about. How does ChatGPT evolve? Where we are with the state of AI. So some of those videos be in the notes as well. But you need to understand the strengths, know the limits, and integrate them into your workflow, all these different AI models, so you can be more efficient and really rising your skill level. And this is the factor for every profession nowadays, right? Video editors and film, they have to have AI to see if there's different ways to workflow. Programmers, there's co-pilots and other code versions to kind of help you write code more efficiently. I think there's always going to be this human and AI interaction. And so you're thinking more and more as that AI and humans become a super version of each other, right? Because AI still needs that guidance from the human, and the human can do more with the AI combined with it. So, like it or not, AI is here to stay, and the smartest clinicians won't fight it, they'll lead it. That's what we have today. If you like this video, please comment, like, give us some thoughts on if you believe AI will replace your job as a doctor, or you are a patient and you believe doctors should be replaced by AI. Please let me know in the comments below and let us know if this is something that's going to evolve over time. And if you like this video, go check out my other videos where I go into deeper dives around artificial intelligence and healthcare as we all face this new normal of healthcare in the future.